Good afternoon, and thank you to the organizers for inviting me to give a talk today at the World Nursing Congress. My name is Jennifer Barb, and I will be talking to you today about ultra-processed food consumption and acculturation among a nationally represented sample of non-U.S. born adults. I have no financial interests or relationships to disclose, and this is my disclosure as an American federal government employee at the National Institutes of Health. A brief agenda for today includes a background on acculturation and its relevance to health. Then I will review dietary acculturation and go over the NOVA food classification system. I will then provide an overview of NHANES and our study population data, and then I will be reviewing a publication that we have investigating acculturation and ultra-processed food consumption. I will close my lecture today with conclusions and public health implications. In 2025, we published a paper called Consumption of Ultra-Processed Foods by Foreign-Born Adults Rise with Increased Levels of Acculturation in the United States. We published this in Frontiers in Public Health, and this is the paper that I will be reviewing today for this lecture. So what is acculturation? Some key points of acculturation include the process of cultural change when groups come into continuous contact with a host culture. This is where individuals adopt behaviors, values, and norms of the host culture. And this process is not linear. It can be bidirectional or selective, where structural and environmental drivers impact acculturation. This process is used in reference to a minority culture adopting elements of the majority culture. The process of dietary acculturation refers to how people adapt their eating behaviors and food choices when moving from their home country to a new environment. This is a figure that we have in our publication, and this is an adapted model of dietary acculturation, and this shows an integration into a Western diet. So basically, socioeconomic and demographic factors come into play in this model of dietary acculturation, as does cultural factors, including the language spoken at home and the proportion of life spent in the U.S. I will be talking to you today about an acculturation index that we showed for the first time in our publication. And this is where individuals come into contact with a host culture, which would be the United States, and they experience changes in psychosocial factors and taste preferences, along with changes in environmental factors. The ultimate result would be different changes in their dietary intake patterns. So before I dive into this work, I'd like to review the NOVA food classification system, which is the basis of how we assessed the food that were consumed in our sample. And so the NOVA classification framework is a categorization of foods based on NOVA levels 1, 2, 3, and up to NOVA 4, which is where you would assign a food as an ultra-processed food based on its ingredients. And this is short-termed as UPF or ultra-processed food. Basically, NOVA 1 includes minimally processed food, and this is where foods do not undergo processing, or they undergo very minimal processing, and it would include whole foods like things like bananas, oranges, eggs, meat, and foods in their raw form, going all the way up to NOVA 4, where this was where industrial additives are added to the food to increase its shelf life and to create ready-to-eat meals. So ultra-processed food in the United States is very common. Diets high in ultra-processed foods are linked to increased risks of negative health outcomes such as type 2 diabetes, obesity, and all-cause mortality. Ultra-processed foods make up about 70 to 75% of the United States food supply, and they account for about 55% of the total daily calories consumed by Americans. As you can see here in this image, the standard American diet is typically comprised of things like burgers, pizza, hot dogs, chips, high sodium and high sugar food content. That is comprised of the standard American diet, which is high in ultra-processed foods. So previous research has shown that an increase of ultra-processed food consumption with acculturation, whereas the influence of the Western diet of non-US born individuals is an area of increasing interest. So the data that I will be reviewing today is based on the National Human and Nutrition Examination Survey, or short-termed NHANES. This is a survey that is put out by the Center for Disease Control, or called CDC, and this combines U.S. population-based data in a cross-sectional format where we have dietary recalls included in this data set, physical exams, laboratory biomarkers, and also questionnaire data. It is a nationally representative sample, and it allows different subgroup analyses based on what the question of interest in. This database allows Diet Health Association research protocols. So the study design of what I will be going over today includes a cross-sectional analysis of NHANES data through the 4 different cycles of 2011 through 2018. We included a population of about 3,600 foreign-born adults aged 19 through 70. We will review an acculturation index that we comprised for this study. Our main outcome is the ultra-processed food consumption of these foreign-born adults. And our analytic approach included complex survey sample analysis, and where we wanted to look at the associations with the acculturation index and the percent of kilocalories from ultra-processed foods. As I just reviewed, our statistical methods included a data set from 4 different cycles from NHANES starting through 2011 all the way up through 2018. We filtered our data set, which I'll review in the next slide, and our variables of interest included the total daily calories from ultra-processed foods and the acculturation index score, which we call ACI. We did survey-weighted regression models, and we adjusted for covariates. We tested the interaction with race and ethnicity of the UPF consumption. So this is an overview of how we calculated our acculturation index, and we included a language score where we asked the individuals, or included the variable of whether the individuals spoke only English at home, and we gave the acculturation value a score of 2. If they spoke only some English, we gave the acculturation value of 1, and if the individuals spoke no English at home, we gave them a acculturation index of 0. We also looked at their proportion of life in the U.S., and just as a reminder, these are individuals who were foreign-born. So if you had a higher proportion of your life in the United States, you got a score of 3 points. If you spent 25 to 50% of your total life in the United States, you got a score of 2, and lower scores got 1. And if you spent less than 10% of your time in the US, you got a score of 0. So an acculturation index is a range of 0 to 5, whereas 0 is least accultured up to 5, which is most accultured. This is a score that we will be calling the ACI score in this presentation. So this is how we did our filtering of our data set. We first made sure that the individuals had a 24-hour diet recall. We also made sure that they were reporting their dietary intake as their usual intake. We filtered adults so that we only included adults aged from 19 to 70 years old. We then chose only a foreign-born sample, and then if they had to have acculturation data, which included their language spoken at home. And this brought us down to a total sample size of 3639. So this is an overview of our participant demographics, and you can see that the individuals in the sample were about 43 years of age. They were slightly overweight with a BMI on average of 27. We had an equal representation of sex of male and female. The majority of the individuals were married or living with a partner at 73%. And the education level demographics showed that the majority of them, of about 45%, had a high school diploma or less. When we looked at their other characteristics, including household size, we see that they were on average about 3.78 individuals in the home, and that the majority of them were at a high poverty threshold of 53%. So this is an overview of how our acculturation index was represented in our sample. And you can see that overall, roughly about 23 to 21% had an acculturation score between 2 and 4. And only about 11% of this group had a high acculturation score of 5. So that would mean that they were most accultured at an ACI of 5. And about 5% had an acculturation score of about 0. So this is a distribution of the acculturation score by race, and this is broken up into Hispanic, non-Hispanic Asian, non-Hispanic Black, and non-Hispanic White, and then other less represented ethnicity categories were categorized into other. And you can see across the non-Hispanic Black and non-Hispanic White, those individuals were most accultured in the light blue teal here, where they had acculturation scores of 5. When we tested whether there was a variation of acculturation scores across race ethnicities, we did see that there was a significant difference across different race ethnicities by acculturation. So then when we looked at the total percent of energy by ultra-processed food, we see here that mostly the non-Hispanic white groups consumed the most ultra-processed food at about 50%. The other group was the next group that consumed the most ultra-processed foods, and the non-Hispanic Asian group consumed the least amount of ultra-processed foods of about 35% or so. When we looked at the association of ultra-processed food intake by acculturation values, we saw a linear increase. And so this shows that among these foreign-born U.S. adults, a higher acculturation was significantly associated with higher ultra-processed food intake, where we saw a 1-point increase in acculturation linked to about a 3% increase in calories from UPF intake. So what this is saying is that based on a person's acculturation into the United States, they begin to consume more and more ultra-processed food. And so this has some health implications that we'll go over next. When we looked at the UPF intake by race, we saw similar trends by the different groups, and we see here that there was an overall significant trend across all different race ethnicity groups in Hispanic, non-Hispanic Asian, non-Hispanic Black, and a variable trend in non-Hispanic White and in the other group. And again, this was an association that was significant by UPF intake and acculturation index. So overall, what I've showed today is that we see a greater acculturation being associated with higher ultra-processed food intake. We see that dietary acculturation is shaped by their environment, not just by individual choice, availability, convenience, time constraints, food access, social norms, and changing taste preference. Findings show that findings from this work are aligned with prior research of other NHANES-based studies where they looked at immigrant diet studies, similarly suggesting that longer U.S. exposure in English are linked to higher UPF intake. And so some suggestions in future work from this should include interventions that should be culturally tailored to support better minority culture eating. So we should support traditional health promoting food practices while helping foreign-born communities navigate the standard American diet. We also suggest culturally competent dietary counseling to help preserve protective food traditions and reduce chronic disease risk linked to UPF outcome. I do want to mention that these correlation values are not causation and that future work in this area is needed. I would like to acknowledge my colleagues in my branch, especially my statistician, Lee Yang, my summer student intern who helped with these slides, Mohib Ahmed, and the co-authors of this work from my branch that contributed to this research. I would also like to acknowledge Dr. Yuri Martinez-Steele, who was a co-author on this work and who helped to develop the NOVA food classification framework, and the Office of the Scientific Director at the Clinical Center, Dr. Leighton Chan, and Deputy Director Julie Goldberg. Thank you for your time and interest in my work.